These nursing fundamentals exam questions feel more like emotional landmines than multiple choice. But that's normal for your ethics and values chapter of your nursing textbook because, like every single topic in nursing school, it's more than just memorizing your notes. It's about studying in a way that makes it easier to see how ethical principles overlap, how they interact, and even how they conflict so that you can protect your future patients, honor your values, and avoid losing your nursing license too. In this video, I'm going to walk you through 3 NCLEX-style questions that wreck brand new nursing students, unless you know how to think through them the right way. Let's get started. Question number 1. A nurse is caring for a terminally ill client who has expressed a desire to stop all life-sustaining treatments. The client's family insists that everything possible be done to prolong the client's life. Which ethical principle should guide the nurse's actions in this situation? A, beneficence, B, autonomy, C, justice, or D, non-malfeasance? Pause the video if you want to think about this on your own before I give you the answer, because the answer is B, autonomy. Let's make sure you understand this so you can get it correct on your next nursing exam. In order to answer this question, we need to know what are the ethical principles. And there are 5. There's beneficence, autonomy, justice, non-malfeasance, and fidelity. We also need to know the basic definition of what each of these are. Beneficence is to do good and promote the well-being of others. Autonomy is to allow our client to make their own decisions. Justice is fairness and equitable distribution of the resources. So treating our clients equally would be one example of that. Non-malfeasance is the idea of do no harm. And fidelity is the principle of faithfulness, agreeing to keep promises and to provide excellent care to everybody that we care for. In this scenario, the client's wishes conflict with the family's wishes. Therefore, this most closely ties to the principle of autonomy. We are going to respect the wishes of the terminally ill client, even though their wishes conflict with those of their family, because it is the client's health and therefore it is the client's decision. It's sometimes difficult thinking about these ethical situations because we also wonder about beneficence, doing good, making things better, and non-malfeasance, doing no harm. And we might ask ourselves, if we remove life-sustaining treatments, aren't we doing harm to this ill client? And that's what makes ethical studies so important, because there's not always an easy cut and dry answer. Because while removing life-sustaining treatments may allow this client to die, some people might see that as causing harm. However, other people may see that as promoting the well-being of a client who may be suffering. But one thing that is clear is that the scenario as presented is a conflict between 2 people who wants to make decisions, and we need to promote the autonomy of the client. Question number 2. A nurse is experiencing moral distress because they are required to participate in a procedure that conflicts with their personal values. Which of the following actions should the nurse take first to address this distress? A, discuss the situation with a trusted colleague. B, request a transfer to a different unit. C, reflect on personal values and beliefs. D, consult with the hospital's ethics committee. Pause if you'd like to think this through before I give you the answer. The answer is C, reflect on personal values and beliefs. Let's talk about how to think this through so you can get it correct on your exam. In order to get this question correct, we need to know what is moral distress. This is different than an ethical dilemma like we saw in the previous question. One way you can study this in preparation for your nursing exam is by using my learning objective study method. In fact, one of the learning objectives for the chapter on ethics in my fundamentals textbook says, describe the difference between an ethical dilemma and moral distress. When you see that learning objective, you need to ask yourself, what do I need to know in order to have an intelligent conversation about that learning objective? And we would need to know what is an ethical dilemma and what is moral distress, because we can't describe the differences between the two unless we know what they are first. This is going to save you time so you don't have to read word for word through your textbook. You can just skim through and find the specific parts that talk about ethical dilemmas and moral distress. And what we find is that moral distress is feeling the need to take a specific action, even if you feel that action is a wrong thing to do. And I'm sure we can all think of some examples of that happen sometimes in healthcare, where our personal morals may be different from the type of healthcare the client is asking for. Because this is a moral distress issue and not an ethical dilemma, we approach it a little differently. Think of it like doing therapeutic communication on yourself. If you haven't learned what therapeutic communication is, You're gonna this semester. In this case, it's basically a process of self-examining your own emotions and your reasons and motivations behind why you disagree with the action that's being asked of you. Once you better understand your own personal values and beliefs, you will be in a better position to talk to others around you and to decide what is the best option for you to proceed. If you discuss with a trusted colleague before you're very clear on what your own personal values and beliefs are, they may not be able to give you the best advice. If you request a transfer to a different unit, that is simply going to avoid the problem. This may be something you eventually do if, after reflection, you decide that that is the best course of action, but that is not going to be your first course of action. And consulting the hospital's ethics committee may not be appropriate because this is an issue of moral distress, not an ethical dilemma. Question number 3. Which of the following scenarios is an example of an ethical dilemma? So this is another question that covers the same learning objective, but from another direction. And hopefully you already see that if you had studied the learning objectives using that strategy I just taught you, then you should be able to answer both question number 2 and question number 3, and probably a lot of other questions about this topic as well. Here's the answer choices. A nurse needs to administer a medication to relieve pain, but knows it may hasten the client's death. B, a nurse feels upset about providing care that contradicts their personal beliefs. C, the healthcare team recommends a blood transfusion, but the client refuses due to religious beliefs. D, a nurse is overwhelmed by the workload and feels unable to provide high-quality care. Pause if you would like to think about this before I give you the answer, because the answer is A, a nurse needs to administer a medication to relieve pain, but knows it may hasten the client's death. This is an ethical dilemma because we have a conflict of 2 different ethical principles. Remember the 5 ethical principles from question number 1? In this case, we are competing between beneficence and non-malfeasance. Giving the pain medication is an act of beneficence because it is providing good care and is helping the patient feel better and more comfortable. However, giving this pain medication may hasten the client's death, which is an issue of non-malfeasance. It goes against the idea of do no harm. Whenever you have 2 ethical principles conflicting, that's an ethical dilemma. Option B is another example of moral distress because this has to do with the nurse's personal feelings and beliefs. C is actually an issue of autonomy. It's not an ethical dilemma. It is a clear example of autonomy. If you're an overthinker, you might be tempted to say that this is competing between autonomy and beneficence. However, the difference is that where you could have a conversation where people disagree on beneficence and non-malfeasance in option A, C is not a dilemma because even if we disagree with the client's decision, we can see it as clearly an application of autonomy. And D, being overwhelmed by the workload is not really an ethical or a moral distress issue. That's something else entirely. If these questions felt tricky or uncomfortable, that's a good sign because nursing school doesn't just test what you know, it's testing how you think through what you know. And if you want to train your brain to handle questions like this with confidence, then it's time to learn a study method that does exactly that. In the next video, I'm going to walk you through my silver bullet study system. It's the 4-step process I use to teach nursing students how to study less, understand more, and feel prepared for whatever gets thrown at you on test day. Head over there if you're ready for that video, or if you want to learn more about how to study with learning objectives, watch this video up here.